All right, welcome everybody. At this time, I'd like to call the October 16th, 2024 meeting of the Board of Health and Order. First item is the roll call.
Mr. Hardy? Dr. Hayes?
Yep.
Dr. Rubin? Mr. Wood?
Present.
Ms. Riley? Present. Ms. Vanderland?
Here.
Ms. Fisk? Here.
The record show we have a quorum. Also welcome Attorney O'Brien. Thank you for being here to help us tonight. Thank you for being here. Next item on our agenda is the adoption of the agenda. Everybody should have an agenda, closed agenda in front of you. The green light is on. Can you hear us now? All right. I'll speak closer. That's a good reminder to everybody else on the board. Please, I feel like, please speak into your microphone. So, adoption of the agenda, if we could get a motion to adopt the agenda.
I'll move to adopt it.
Second.
We have a motion and a second. Any discussion on the agenda? Hearing none. All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on our approved agenda is the approval of the minutes from our September 18th, 2024 meeting. Hopefully everybody's had a chance to review the minutes and entertain a motion.
I move to approve the minutes from the September 18th, 2024 meeting.
We have a motion.
Okay.
We have a motion and a second. Any further discussion?
Nope, just I found a couple edits, that wrong date and a couple of things, so they're fixed. So I think we're good. So
Very good. Any other comments or discussion on the minutes? Hearing none. All those in favor, please say aye.
I
Opposed, say nay. Motion carries. Next item on our agenda, board president announcements. I don't have any announcements. I guess the only thing I could say is election day is coming up. Please vote. That's important to our democracy and to our republic. Next item on the agenda, health officer's presentation and report. Dr. McGleary, I'll turn it over to you. Item 2439.
The health officer's report in your packet is pretty much self-explanatory. Does anybody have any questions about that they would like addressed? There was one, the bottom part of page 42, there was one section inadvertently cut off. You'll notice that the chart at the bottom of July, August contains active TB and latent TB. And someone was kind enough to point out that the latent TB cases for September fell off, but that's been corrected. So thank you for noticing that.
I do have a question about, it looks like it says like July, August, September for, like it says budget, July, August, September, and then it has the totals and the unexpended, but those don't seem to all match. Like July, August, September, the totals don't match those. What is the total actually showing us, I guess?
could you tell us?
It's,
What
there's a
page?
ton of different sections. There's, let's see, let me go all the way to the top here. There's so many of them. If you add them up and go across, even like, let me see if I can find one. Because of course I didn't write the page down. One of them was even our lawyer. I don't know what page that's on, but that one just stuck in my head.
So
I'm showing you the 3 months at a time, but the total is year to date.
Okay, and that starts from when?
January 1st.
Okay, that's what, that was. where I
Yeah,
was
it's
confused.
year-to-date total.
Got
yeah.
it.
While you're up here, some of the funds are running in a deficit. I assume that's just waiting on reimbursements.
The grants that are running in a deficit are reimbursement grants where I make the expenditure and then submit the receipts to the state for them to send us the money back. So that is exactly what it is. We're waiting for reimbursement.
I guess while you have the microphone, anything else you want to tell us about how we're doing budget wise?
No, well, we did have a meeting with State Department of Health today. Just give an update on like the HFI funding for 2024. Currently, as of the end of Q3, we have spent around $682,000. So we will have some carry forward available to use in 2025. They will make those forms available soon. So if we do want to use those funds for next year, we can. Otherwise, we can just leave them in our fund balance.
Okay, great.
So just to be clear, you're saying that of the, how much did we get from health?
It was like 3.2 million.
Okay, so we're gonna have about 600,000 unexpended at the end of the year.
No, we'll have more than that. So
Oh,
far, we've
okay.
only spent around 682,000 as of the end of Q3.
Oh, okay,
Yes.
okay. So we have a balance of over 2 million.
I'm guesstimating that we will spend around 1.5 million.
Okay,
We have been, Jen and I have been meeting with the HFI awardees that we've had to see where they expect to be at the end of this year, letting them know that the funds cannot be carried forward. So there will even be some unspent funds in the awards that we have issued to the 19 awardees that we have. But I'm guesstimating that at the end of 2024, we'll have spent 1.5 million out of the 3.2 million.
okay.
And you said they're letting us carry that all over?
Yep, it'll go to our fund balance. So if we don't spend it, it goes to our fund balance. However, if we do feel like we want to add it to what we already have budgeted for 2025, we can do that with a carryover form.
Sounds great.
And having a balance, not having used everything, is that something that we are discussing with our different departments to see if they have any specialty things they'd like to work on for that? Is that allowed?
Oh, absolutely. As long as it fits one of the core services within HFI, yes. Yeah.
So there's like, you guys are doing some kind of survey or something of the departments, I assume.
And this is funding that was supposed to go to community partners, and the community partners gave us their budget. And many of them really came in under budget. And so that's why there's funds left over. So we tried to fund as many community partners as possible. And so it may be that we can either fund additional community partners with this money, or if there are specific projects that need to be funded within the department, we'd have to come up with a project that meets the HFI criteria. So one of the pillars of
Mhm.
that the state has set up.
Good.
Thank you. Any other questions on any section of the report?
One very small thing, and I don't think it's a big deal, I was just curious. In the social media section, there was kind of a big dip in the August 9th through September 8th social media posts. And like I say, it's not really a big deal. I was just curious why we went from like 29 to half that and then back up. If there was like somebody that was out, or, I mean, I did notice that we still actually ended up reaching more people in spite of that. So, I mean, awesome, like, efficiency. Like I said, hardly a big deal, just curious.
How are we doing? My name is Matt Gotch. I'm the Communications and Events Coordinator for the department. The dip in August to September, certainly we speaking with the health officers, with Robin Vita before she left, we have the strategic plan where we want to kind of highlight either our programs or certain days of the month or month. Like say August is like, whatever national month this is. October would be obviously Breast Cancer Awareness Month, so we did a post for that, but certainly there was just a dip in the August. There just wasn't as much to post there.
Okay.
So I was happy to see that the numbers were you know, still kind of maintaining their, where they were, even though we had less posts.
Yeah, like I said, more people reached in spite of it, so not really a big deal per se, just curious, so. Okay,
Absolutely.
very good.
Thanks, Matt.
Thank you.
Actually, can I ask you a question?
Yes, ma'am.
I was just curious, because the total reach, unique people who've seen the post went up from August to September, 21,000 up to 158,000. And was there like one or two particular posts, information that really got a lot of,
So those would be because
Circulation.
we've started boosting a little bit more,
Uh-huh.
which are either sponsored content or paid advertisements.
Mhm.
And those, depending on how much we put towards that, end up reaching a bunch more people. In fact, I have a little chart that I can pass to you guys. So typically, and what this is saying is that when we do boost a post, it's seen or it gets a higher rating by 364%. So it's seen by that many more people, or at least a reach means it has the potential to be seen by that many more people. Obviously, our biggest hitter and our biggest reach when it comes to that outreach and audience on social media is Facebook. So that's the only one that we're doing these paid advertisements on. Dependingly, we've had, let's see, we post almost every single day. And since I've taken over, I think we've had close to 200. I think it's 182 posts so far year to date. Only 7 of those posts have been boosted or paid content, which have all either been our hosted events or a new program that we're trying to highlight. And I would say that they've definitely gotten attention whenever we do that, much more so than without doing that.
thank you.
Any other questions on any section of the report or for Matt?
I have a question about the lead testing.
Sure.
On page 38, it lists the elevated tests by zip code. Are these the only zip codes that were actually tested, or was there no elevations in the other zip codes in our county?
Don't think that's me. I think that might be. I will, one quick thing on the social media, though, I will say that even without the boosted content, year to date, our reach was still higher than it was of all of last year.
Great.
Thank you.
Okay, so that chart is simply elevated tests that were found in those zip codes. So that doesn't mean that children in other zip codes aren't being tested. It's just that if it's not elevated, it doesn't land on that chart.
Okay, so we are targeting all of our zip codes
Mhm.
just because it looks like, and I don't know if you have a chart that shows how many people are tested in each of the zip codes, but it looks like we've got like this ring around the outside edges that we
Mhm.
don't have any positive
Yeah.
lead, which maybe that's good, or maybe that's because we're not testing them, or.
It's a mix of both. So one is that typically older housing stock kind of follows the river. So most of our elevated zip codes that follow the river are the higher number of children with identified lead poisoning. But another part of it is that we do see really low testing rates in those zip codes. So we don't track it if they're not elevated, but that's certainly something we could look at. So, but again, they have smaller populations, and so it just might view a little differently. But
Yeah, it's only like 10% of our,
Mhm.
of our county, but it is definitely, if you draw it, it's literally like a map like this where there's none.
Mhm.
So I just want to make sure we're actually testing
Yes.
those outlying areas. So, yeah, that was my only question.
I did have a question along the same lines, but in well, I'm on page 13. The pregnant women surveys for the kids. And that there only seem to be 17 that seem kind of low. Just wondered, Dr. McLeod, you know, your thoughts, is that good? Is it low? Is there something more we should do to promote pregnant mothers asking for those kits or tests or?
Do you know what your number of surveys were between the previous quarter, Breezy? He's asking about the lead surveys and the perinatal program. Renata?
Yeah, page 18. I have a question on that line as well.
Page 13, I think, is what I'm on.
He's reading those.
Okay, I apologize. I was looking for the chart. What was your question again?
So on page 13, from July to September, we received 17 different surveys from 17 different people. 11 who we successfully contacted. That just seems a little low to me.
Mhm.
Not, just, is there more that we should do or different, something different to try to get, or is that good? I don't.
Yeah, so it's better than what it has been.
Okay.
We've been trying to continue to evaluate what's the best way for that, because the issue is we have the materials in the community, people come across it, they're interested, they'll fill out the survey, but by the time we contact them, then they don't respond. So we try to either, based off the information they give us, we'll call them, text them, sometimes they respond, sometimes they don't. We actually receive even more surveys than 17, but a lot of them will fill out the survey. But then when it has the next part for you to give the information, they don't give the information, so we can't contact them. The way that it's designed with our IT is kind of all tied into our lead team, because then we use that information to open up a case if needed and follow them and document it there. So we're still trying to figure out the best way to do that, but I will say that it has improved. So we try to streamline the process, so the information comes in, we kick it to environmental, and then even more people is falling through the cracks. So then the coordinator over this program, she actually contacts them herself and has kind of a conversation with them, let them know what to expect. And then we saw a little bit more uptick.
Okay, thank you.
You're welcome.
And you said this is in the Women's Care Center? Is that where these are primarily being offered, or?
They are offered there, but we offer them throughout the community. So the coordinator of this program, she did a really good job with kind of getting contacts with like all of the providers' offices, OBs, pediatricians, some of the same offices we contact to for our Ember program to kind of get buy-in, where she asked them to post our poster. There's a big poster there. We have pamphlets. So there are a lot of places, but the number of women that we see actually complete the survey and have the information is through Women's Care Center, because our CHWs are there. That's somebody that's actually explaining the process, why you need to get it done. Can I ask you a few questions? Would you give your information? And then those are really the ones, most of the ones that we're able to then contact to get the risk assessment. And I feel like that's because they're having that little bit of more dialogue with them.
And so there's no Women's Care Center on the outlying communities, because I noticed again, this ring of the zip codes that aren't, there's none from those areas.
No, it is not, but we do have another CHW. Our MIH team is small, but we have another one who is more of like the community-based one. And she's really focusing on women who are postpartum and need additional support. But a lot of those women come from Women's Care Center, because that's where we encounter more of the women. But we are seeing more women coming to us looking for those services. And then that is an opportunity for her to be able, depending on where they live, also have those conversations, because we have that in our workflow for the women that we see when we do the social needs assessments, the resource navigation, the history for their medical history. The lead assessment is one of them too.
It's the same. I would love y'all to brainstorm how to reach those 10%, because it's the same zip codes where they're just not. And I don't know if it's resistance to, or they feel like they're not part of our St. Joe County Health Department. But
When you say outline, do you mean like
Like-
rural, more the rural areas?
yeah, like Osceola, New Carlisle, North Liberty, Walkerton, Lakeville, Bremen, Wakarusa, like absent,
Mhm.
which that's why I say it kind of goes like this.
Yeah, yeah.
So I know those are kind of the more outlying areas,
Mhm.
but it's 10% of our county. And I feel like they're just, I would love to know why they're not getting into
Yeah.
those,
Yeah, and we definitely can brainstorm and look at that. We can look at maybe what OB or clinic providers are out there and try to get them to do the same buy-in or any outreach there too.
What we found with outreach of some of the schools that are in those areas is that they often use the neighboring county's health department as a resource. So Marshall County, I know that Lakeville, the schools in that area often rely on the Marshall County. They have a relationship with them. And then New Carlisle, LaPorte County. So We
Yeah.
have, we
just have
continue to reach out.
90% of Lakeville is in our county.
Yeah, no, I know that,
So
but
it's kind of like, why do they feel like that? I want to make sure they feel like we are here for them.
Mhm.
You don't, just because you're down farther.
I think when we did our event there, some of it, what we found out is like the proximity to the closeness to them is closer to drive, you know, to the neighboring county than it is here. That's why we were trying to be like, hey, we can bring this to you. Hey, we are here, but recognizing sometimes when we do the resource navigation to what they need is actually closer there, but developing those relationships so we can still also give that information to them. Maybe this is not in our county, but it's closer to you and they can help you with that.
Yeah, yes.
Or would, and maybe you're already thinking of this, but would it also be possible to, I'm thinking, you know, there are women's care centers and I think LaPorte and Michigan City. I think there's one in Plymouth. I know there's one in Elkhart. I mean, all the ring, there's one in Niles too. Like there are ring counties and then obviously OB practices, small family health practices, kind of in those smaller areas. Even if they just, if the practices had information about the program, and that way, when they get somebody's address, realize they live in St. Joe County, then they can, you know, then at least you get people aware of the resources here. Because you know, if we can pretty much only serve people in St. Joe County, somebody lives in St. Joe County, even if they're going to Marshall County for OB care, there are certain things that maybe their county health department probably cannot provide, like blood testing. So, I mean, it seems like that's what you're already thinking of, but
Yeah, I will just say when it goes across counties, you know, we could do that. We only can service St. Joe County, but then when it comes to like test results coming back, it's going to go to the county that service them. In St. Joe County, we have a more robust lead program. So like we provide a lot of services to any child with whatever your lead level is, as long as it's 3.5 or higher. Some counties, based off of their staff, they only do what is statutory. So they may not provide the same level of service that we do if we test them and the result goes there.
so I guess that makes me think of another question, just to be clear. So when, let's say that you live in Walkerton, for example, in St. Joe County, but you are getting, I'm going off, but like, you're getting a lead test, you know, blood test for your child in Marshall County with a provider there. Is that reported as a lead test for St. Joe County or is a lead test for?
It's the residents. So
Okay.
if their resident address is St. Joe County, it's going to
Okay.
come to us.
Okay.
The issue is if it's not in St. Joe County, then it goes to the neighboring county.
Okay, so if you're a provider here is testing somebody who lives in Marshall County, for example, that
Mhm.
info goes to their health department.
Right.
Okay.
Yeah, if their
Okay.
address is Marshall County, it's going to go there.
Yeah, that was a little detour, but
Yeah.
I was curious.
That's all right.
Right.
Any more questions from me?
And we continue to work on relationships to talking to the schools. We have a school nurse liaison, health liaison, and we've been meeting with the superintendents and letting them know the resource that they have here. But we want to have those relationships and we're working on building them.
I have a question on the environmental report. I thought in prior reports, we had a year-to-date prior year, 2023. Did you ask that question already? Oh, and which I always found informative, useful to see kind of what's the trend year over year.
That was inadvertently left
Okay.
off. That was not intentional. So next time you will see it again.
Okay, great. Thank you. Any other questions on any section of the report from the board members?
Is there any way we can get an update on the mosquito spraying and how our mosquitoes are coming?
Absolutely.
Sorry, put you on the spot.
Good evening, folks. Brett Davis. Right now, mosquitoes are ideal. We have not had a West Nile positive in about a month, which is great. Our cooler temperatures have really reduced our numbers. we're basically done with regular trapping. However, we are still doing sporadic trapping and specific trapping. We are still finding mosquitoes out, and I anticipate finding them out for a while still. I treated a lot of areas last week. I even did a test for some mosquitoes we collected that are still, they're not West Nile positive, but the antigens are still out and about. It's helpful that the birds are flying south for the winter, so we don't have that reservoir host, but so mosquitoes are good, but people should still be cautious because that threat will persist until we have a good hard frost. It's time to pivot to tick season.
And you're not anticipating spraying anymore, needing anymore.
Ideally, we won't be, we only spray when there's a public health threat. Right now, there is not currently a public health threat as there's nothing positive. There have been positive, there's been positive Tripoli in Michigan. We're keeping an eye on that, as we always do. God forbid anything like that were to happen nowadays, for us, we would entertain that, but we also aren't going to go out and spray just for the sake of spraying. We're only going to spray if we actually can get a result. And if we continue to have nighttime temperatures as they are, we aren't going to have very good results. So
Perfect. Thank
that's
you.
the status of mosquitoes right now.
Just
you.
a clarification, Tripoli is Eastern equine encephalitis.
Thank you. Any other questions on any section of the report for Dr. Migliori? Hearing none, can I get a motion to approve the report as presented, or
I will move to approve the report.
Second.
motion and second? Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next section on the agenda is new business. Item 2440, discussion and vote, job description, community health worker supervisor.
We recently had due to transferring of jobs, we have an opening for the community health worker supervisor who supervises the other community health workers. Did you want to say, I'm sorry.
I
You're still
didn't-
standing
I
there?
know, I didn't back up here. I didn't know if you was gonna take it away.
Please do. Sorry.
Yeah, so we have have had someone who actually served in this capacity, but not with the official title. And we have had a couple CHWs. One went to a neighboring county that was closer to her. Another moved to a different specialty where we recognize the CHW supervisor official job description never went through the Board of Health, and so we wanted to have an opportunity to do that now that we were looking at the jobs. The basis of the job description is the regular CHW job description that has already been approved, because they will continue to have their regular CHW duties with respect to the areas that were that reflects the supervisor duties. So on the last paragraph of duties, is what was updated. And then the first section of job requirements.
Sorry, did you say that you anticipate the supervisor to also be doing her own duties? Okay.
His or her.
Yeah,
Yes.
his or her.
So essentially, they will do their regular CHW duties, but then supervise the team of CHWs day-to-day operations. So for example, we have locations for all of them as they're in the community. They update a location calendar. They will oversee that. Support for new hire documentation, because they do the same work too. So they'll be able to say, hey, you should be doing this or that. I ran a report and this is not complete. So they're able to help us as we have continued to grow our team and our programmatic activities with more of that day-to-day, making sure things are done the way they're supposed to be.
And you feel like, are you gonna decrease the duties that they do have though? Like, how do you feel like they're gonna be able to take all that on as well as their own?
So far it's been balanceable. Yeah,
Just work
so
on
they
it.
do, yeah. And the supervisor duties it's a lot, but not as much as you would think it is, because we kind of have a system that, as long as everybody's doing what they're supposed to be doing, it kind of flows really well.
So the supervisor is basically the kind of the point person
Mhm.
among the CHWs in terms of their first line of contact if they need to deal with scheduling, administrative stuff.
Yeah. Yep,
kind of the idea.
absolutely.
Okay.
Coverage, some of our community partners that we're at regularly, if they are sick or need to be off, then they're going to arrange coverage for that place to make sure that we do have somebody that's going to be stationed there for the hours that we committed to.
Okay.
And then this maybe, I don't know if this is a question for here, I don't see this in here. So supervisors of our other departments are all paid the same salary, are they not? Is that
Unit directors, yes.
not the same as a supervisor?
Mm-mm.
No,
Okay, so there's no set salary that they would have?
no.
Okay. I assume there's gonna be a salary difference.
Yeah.
Any other questions or comments? Hearing none, I'll entertain a motion on this item.
I think I'd asked earlier, if we're gonna add a line about.
There was a line added at the very beginning about the supervising CHW will be responsible for providing day-to-day oversight of responsibility. So there will be that there.
You know what, there's one more thing I just, I noticed too that I wanted to ask. In the difficulty of work, I'm just, there's a section that says, it's the third line, it says exercising judgment to ensure effectiveness of division operations. And then it says, and to develop plans and procedures for public health emergencies and threats. Is that something, I guess I'm curious, is that something that is actually part of this job description or is that?
So this is something that's in all of the CHW job descriptions.
Okay,
And so like, I kept it the same and just
Oh,
added
okay.
the supervisor duties.
okay, okay. All right, I just didn't know if that was, actually, how would community health workers do that? Like, what sorts of, what are we thinking of when we're talking about developing plans and procedures for public health emergencies and threats?
And so I would say, off the top of my head, like they do provide input when we're looking for like restructuring things, putting it official on paper, like
Okay.
during COVID too, they were instrumental in some of the COVID testing, setting up clinics. So to me, it would be kind of feedback based off of
Okay.
what's working well in the community and developing a policy for that.
Got it. Okay, thank you. Thank you. Now I know. Okay.
So the person that oversees them would be the one that would be responsible for actually making a policy or procedure related to that though, correct? Like the public health threat or whatever?
Yeah, they would be giving their input, just like that part of the job description is in the regular CHW job description too.
So, but who oversees them?
So the CHWs is the assistant director, and then it's me.
Got it.
Any other questions or comments? If not, I would entertain a motion on this item.
I will move to accept the job description.
Thank you. We have a motion. Do we have a second?
Second.
A motion and a second. Any further discussion on this item? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries.
Thank you.
Next item on our agenda, under new business, item 2441, discussion and vote, 2025 Department of Health fee schedule, food services, environmental health, and vital records.
The updates and the fees are partially driven by new state ordinances that, for example, in the food department, HEA 1258 has said that we can't exceed a $200 fee for mobile food trucks. And so we had to take that amount down. There hasn't been an increase. I don't want to take it away from you.
Hi, Carolyn Smith. Um, So there hasn't been there have been increases in other fees 2 years ago, but we've not increased any of the temporary fees. And so what we have proposed is that there be an increase in our temporary fees, and sort of kind of that will offset the decrease in the fees, the mobile fees. The mobile fees, based on what we have, the permits that we issued this year, with the reduction next year, we're looking at 46% less income. We expect that because the fees have been are going to be reduced, that there will be more people who will want to have a mobile temporary food permit at $200 annually, as opposed to $375 or $325. But again, based on numbers for this year, that reduction will result in 46% less income from permits in that category. So the increase in the temporaries, 1 day, 2 day, and 4 day temporaries, which is just a slight increase, we haven't had one in 3 years, then that will kind of offset it a little bit. And we have had a 12% increase in the number of temporary events year to date through September. So that also means that we have more staff out doing these events every weekend. Is that, yeah, I'm sorry.
I was gonna ask you, you kind of answered my question there, but can you tell us a little bit about the effort involved with each of these permits, just so we can get a sense of, we're really only, in my opinion, I think we're only covering just a small fraction of the actual costs we have associated with these permits and inspections.
Okay, so the temporary permits, if they are mobile trucks, they may go through the same process that a brick and mortar does, in that they submit a plan and review. We review those plans for the mobile unit. They get an approval. There must be an inspection before the permit is actually issued. That is the same with even a temporary event. They submit the plans for the event. The participants in the event are called or contacted so that we get clarity on what they're serving, when they're going to be serving, whether they have other requirements to serve the food at the event. The permit is then issued and inspections are done on site the day of the event. So there is some back work before we actually show up to the event.
On the multiple day events or the 2 or 3 day events, are we doing additional inspections or not?
No, temporary vendors are viewed just like a restaurant. We aren't in the restaurant every month or whatever, so there is a schedule. So if we have a vendor who has participated previously in the year and they have had no critical violations, then we might not see them the next time. We might not schedule to see them. If they have had critical non-compliance issues, they would be seen at the very next event or multiple times during a single event, multiple days, excuse me.
The other thing of note, it's hard to keep your staff going because it's nonstop, especially if you think about like a Notre Dame football weekend. You have all those vendors. You have the Fusion Fest. Not only did they have established vendors, but they had a significant number of brand new vendors who are sort of learning the ropes. They had a car show at the 4-H fairgrounds. They had a September Fest amusement park type thing at the 4-H grounds. All that was within a 2-day period. And that's on top of the regular duties of inspecting local restaurants and keeping up with the demands of just quote unquote the regular stuff. So these temporary permits, you're like, it's almost like being on call 24 hours over a 72-hour
Okay.
period. It's just, it's brutal. It really is brutal on the team. And you have to be a certified food inspector too. You can't just take anybody off the street to do these events. These guys are highly trained and have to know the rules and the codes backwards and forwards. It's really tough.
So if somebody wants to do like several events, could they just get the annual?
Yes, they can get an annual temporary or an annual mobile food establishment. And it's to their advantage, to get an annual, because, well, next year they're going to be saving a lot of money. But when you calculate, you know, a 2-day event or a 3-day event, times several times in, you know, in the year, calendar year, then yes, it's to their advantage to get an annual permit rather than the permits over time for the multiple events.
And if they get that annual event, I assume then that's less work for you as well?
If they have an annual, then that means they have gone through the upfront work, process of being reviewed and inspected. And as long as they are compliant during their inspection, you know, initial inspections, then yes, it's let's work, because we don't have to go to that event. If we have an event and there are 10 vendors and, you know, all 10 have an annual and they have had previous inspections that were compliant, then we don't, we don't go to that event
But if,
or may not go to that event.
but just to be clear, so, but if somebody has a temporary permit and they do maybe 3 events over the course of the year and they get 3 one-day permits, every time they have to be, do they have to be inspected every time?
They are not inspected every time. If the previous time we saw them, they had 100%.
Okay. How much is an annual permit?
It's well, an annual permit is $375.
Okay.
But we're
That's,
proposing,
the only thing that's changed or has to be reduced is the mobile, because this is a statewide legislation change that's all the counties in Indiana can't charge more than $200 for a mobile unit.
That's per year, 200 a year.
For an annual, yes, for an annual. And that's the mobile. So we're talking about a truck or a trailer, not temporary where they're under a tent, you know, that kind of thing.
So question, this sounds crazy, but why are we not charging more for that initial permitting process? Meaning you're only charging $35, but most of your work is going into that initial time, correct? Like, because hopefully they're passing their inspections and your initial work is so much more with that first, like, I feel like that should be a higher fee.
A 1-day event.
Right, because this is the thing, this is just business stuff. You're trying to push somebody, if they're gonna do a 1-day event and they have to pay $75, but they can pay $200 for the whole year, and they think they might do other events, they're probably gonna be like, well, man, why would we pay $75 each time? And if they don't do another one, oh, that's on them. And if they do, well, we already did all the hard work. You guys are doing all this hard work in the first time, but you're not getting paid enough for that. Like, I don't know what the salary is but $35 probably doesn't even cover your wages. Do you understand what I'm saying? Like, why don't we have a higher first event fee?
It's not it's a 1-day event, I'm sorry.
Yeah. Well,
And I understand what
okay.
I understand what you're saying, because like in a brick and mortar, there is an additional fee of an administration fee, and that's a fee that covers our, you know, work, our inspection, our putting it into the computer or whatever. but temporaries don't have that administrative fee. And, I
You
hear
still
what
have
you're,
to do all that same work, though?
Right.
Yeah.
Sort of, yes, but I hear what you're saying. However, I just wanted to, even with our increase, ours is, on the higher side when you look, at neighboring counties and across, Indiana. They, $20 for a one-day event, $50 for a 3 or 4 day event. So I hear what you're saying. I don't know how we could make that change to add an administrative fee to a one-day temporary permit.
So just
You-
for,
go
I'm
ahead.
sorry, I didn't.
No, no, no,
interrupt
go
you.
ahead.
So just for clarification, because it was something that you said earlier, so it's the mobile, only the mobile that is being reduced to 200. But if they have a tent, we're still charging the 375
If they want an annual.
if they want an annual.
That is
Okay.
correct. It's only the mobile
Gotcha.
food establishments that have been reduced or will need to be reduced.
So I have one more question. Just to be clear, so when you're asking for a permit, is the permit based on the length of the event? So for example, like the 4-H fair is a
10-day.
10-day event now? Okay.
Mhm.
So so even if you were only there for 2 days, you'd still have to buy a 4 to 10-day event pass?
4-H fair, you can't be there just for 2 days, because
Okay.
the coordinator dictates, you
Okay.
know, and many of them, you have to be there for the length of the event to
Okay.
make it economically feasible for the coordinators.
Okay.
That's out of our hands.
So it's basically it's the coordinator, whoever's putting on the event. Fusion Fest says it's a 2-day event. So you need a 2-day event pass.
That
And
is
so,
correct.
so we're not the ones deciding that. It's the event that's saying it is X number of days long. You potential food service provider need to have a permit for X number of days. Go to the health department and get it.
That is correct.
Okay. And the event, the pass itself, it's not like you can't buy a 4 to 10-day event pass and say, well, I'll do Fusion Fest and then I'll do a Notre Dame football game.
No, because by definition, it is a single event or celebration, and single. So if single by definition, I mean, by identification, that event is a 4-day event or a 2-day event, that's the coordinator's event.
Okay.
But a person can't take that and say, okay, I want 10 days, and they go here and here and here and here. No, it's a single event or celebration.
And then the 4 to 10-day, like that span of time, is there a big difference for you in the amount of work that you're doing for a 4-day event versus a 10-day event? Or perhaps because it's a 10-day event, you only have to go every other day to inspect, or because it's the same price regardless of whether the event is 4 days long or 10 days long? Does it?
It does, for Fusion Fest, for instance, we were there, we had staff rep on both days, not the
Okay.
full team, but they were there both days. 4-H fair, there is somebody present, you know, every day. Not all of us, we all go out the first day, and again, like a brick and mortar, non-compliances are fewer, so we send less people out to do fewer inspections, because if you're doing a good job, if you're
Okay.
compliant, then we're not gonna be,
Okay, so it's not as
harassing you.
intense it's not intense the whole 10 days. It's just like the first day or two. And then
Right.
okay.
And same thing with Notre Dame. You know, the first game, everybody goes out and everybody get, they get inspected. Second home game, fewer non-compliance, so we may not see every vendor that day, that time around.
And is Notre Dame, is that considered one event, though?
Yes.
What are your thoughts on a 1 to 3 day fee? And it's $75, meaning you're covering yourselves then. Let's put it all together. get rid of the 1-day fee. Like, why are we making it, that sounds terrible, but why are we making it so cheap? You guys are working really hard. And if we make it a 1 to 3 or a 4 to 10, and then an annual, and like I said, if we bump our annual down a little bit, then people are gonna be more tempted to pay that extra, even if they don't use it again, but they'll think they're going to. You guys just work so hard for $30.
No, they do work very hard. I think the two considerations are, one, a lot of these vendors are sort of mom and pop organizations, and we're not wanting to, they're only doing it for 1 day and they have to be able to pay their staff, and, you know, we want to, we want the community to participate in these affairs. That's one thing. The second thing is that the other counties around us, we don't want to run off the vendors locally if, you know, for our events, because we're pricing them out of participating. And then they're just going to go everywhere else but St. Joe County.
You're the board, I do what you tell me to do, I just.
That's the rationale.
I can certainly see a rationale of keeping the barrier to engaging with us low so that we are there to protect the public health. So I can certainly see that. I can see your point too. So.
Yeah.
I feel like we're doing it's almost like it's a charity thing, meaning we are helping those mom and pop places, but you guys are working for free.
That's why we're a not-for-profit.
Yeah.
Well, you can also encourage people to go for the annual pass and
Yeah, that's why I was
participate
like,
more.
If you make it a little
Yeah.
bit more expensive on the short end, then they'll go for the more expensive one, but it's covers them longer.
Yeah,
No, I
but at the
get it.
same time, if it's, you know, like the 1-day church carnival and
Right,
some of the
right.
parishioners want to, you know, bake cookies for the day and sell it to give money to charity or whatever.
Yeah,
1 day is-
not-for-profits, they don't pay.
Pardon?
Not-for-profits don't pay.
Oh, okay. Well, that's good then too. Which is even
We
worse.
inspect them, but they don't pay.
Okay. Well, that's good.
All right, so we've got, thank you,
I'm
Carolyn,
done.
for,
Thank
for your
you. Yes,
patience
thank
with
you.
us.
Thank you for all your
Appreciate that.
free hard
Thank
work.
you.
We
It was
also,
actually very educational.
we also have, the property transfer fee, which we have to get rid of by state statute.
Do we have to are we doing all of these in one vote?
Well, it's on one item, so
Oh,
I think
okay.
yes. So we're doing, food services, health, environmental health and vital records all in this one item. And so, I don't think there's really anything to talk about on environmental. That's state law.
Oh. We're also voting on the vaccine schedule, right?
No, the vaccine schedule is here.
Oh, there it is. Okay.
Item
Okay.
37.
Oh, okay. Okay.
Did you need to hear something from Vital Records?
I just have a quick question. So since we're comparing fees with other surrounding communities, I assume that's why we changed them to what we did versus, or I'm all about you guys are not, you need to make what you're worth.
Hi, I'm Erica, Director of Vital Records. I like to compare to Allen County because that's the largest, closest county to us. They're at $20. And up here in the north part of Indiana, what we set the fee schedule at, the rest of the counties kind of follow. And to be fair, our efficiency is a lot better than other counties. We have people tell us all the time, it's in and out with us. Our mail is turned around within 48 hours of receiving it. Online requests, the same thing. If you pay the $42 fee on Vital Check, you're gonna have it the next business day. You go through the state of Indiana, it's 30+ days regardless of how much you paid. So I think $20 for a birth certificate is fair. It's not overpriced compared to some of the larger counties throughout the state. And we haven't raised our fees in several years. So. And I did do a small calculation for one of the board members' requests for future health officers report in 1 month, and that was the month of September. Our fees would have increased over $12,000 just by raising it to $5.
Wow.
Just FYI for.
So the amount raised you feel is sufficient and it's comparable to the county that's, okay, that was
Correct.
my question.
Mhm.
So wait, how many, this is just birth certificates?
Yes,
How-
the number of birth and death that were issued for the month of September, if we raised our fees by $5, just within that month, we would have had $12,000 plus.
Okay. How, do you know the number of birth certificates plus death certificates?
So we
I-
had
I could figure that out, but.
and I did this based
Uh.
off of our transaction log, so this was
Uh-huh.
actually the stuff that went through our office. We had 1,089 birth and 1,426 deaths issued. So altogether, if we did all of the increases that I have requested, altogether it was $12,845. And
Okay.
to put, just a range, there was only 8 paternity and correction affidavits, so that's $25 increase for those things. And then there was only 4 copies of those documents issued, so that would just be an extra 75. So the amount of birth and death is vital. Like that dollar amount is significant for what we would be increasing our revenue by.
But, and then you can also, if somebody has a hardship exception.
Yes,
You can also.
so that is something that was slow to take off, but it is coming around thanks to the CHW program. So we have, I did just, I can't tell you the exact month that it actually went live, that we actually started seeing applicants. We've only had 7 applicants and actually 13 records that were requested. But yes, that hardship, I believe the amount was $500, but yes, it is available to our customers if necessary. And then hopefully, we kind of wanted to gauge how it was going to be accepted. And then hopefully next year, we can kind of push it towards some of our community partners like Broadway and things like that to kind of help there in that area. Okay.
Thank you.
Dr. Miglioria, I assume this, your recommendations are here and they stand based on what you've heard?
My recommendations stand, yes.
And one other question, and Brittany O'Brien, you might have to help me here, but is this purely a board decision or does this go to county council for ratification?
I believe that it goes to the commissioners,
Commissioners,
council, I lied.
okay, it does go to the council.
If it's a financial matter, the council will ultimately bless it, or maybe not bless it. I don't have a vote, but
Okay, yeah. I think, well, I won't say what I think their opinion is, so, entertain a motion or any other questions on this item?
Good.
Oh, you want us to move?
Yeah, I'll make a motion to accept the changes to the financial fees for our 3 different departments.
We have a motion, do we have a second?
Second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Next item, under new business 2441, discussion and vote, 2025 Department of Health fee schedule. Oh, I'm sorry, that's the one we just did. Next item, 2442, discussion and vote, 2025 Board of Health meeting schedule. Everybody's had that in front of them and hopefully had a chance to review it and entertain a motion or any comments, discussion on this item.
I mean, I have one day where I know I can't attend, but otherwise it's fine. I'm assuming that. I'm not asking anybody to change everything around for that.
Okay, and as it draws near, I don't know which one it is, we can always talk about it.
It's in June.
Okay,
We'll be on vacation in Ohio.
okay. Any other? If hearing no discussion, I'll entertain a motion on this item.
I move to approve the 2025 Board of Health meeting schedule.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. The next section on our agenda is grant requests. We have none. The section after that is old business. Item 2437, discussion and vote, Department of Health fee schedule, nursing unit as tabled. So we did table this item, I believe, last month.
So that we could do all of our fee schedules at the same time.
Right, okay. So everybody's got the table, the chart in front of them, and Jody
Jody Paris,
go ahead.
Director of Nursing, ninth floor. The nursing division is requesting support to approve and amend vaccine cost to be more in line with other providers due to price changes. A couple of new things, Mpox is on there, and it's brand new to the fee schedule. Rabies is also brand new to the fee schedule because we usually haven't tied it to a price. So now that people that are requesting the vaccine can actually see how much it costs versus us calling, so. And then the formula that we used is the same as with other providers in the area, doctor's offices, which was the cost of the vaccine plus the administration fee times 106%.
So it looks like most of what you're doing is adjusting the fees based on changes to the cost of the vaccine itself.
Correct.
Which it looks like a lot of them are cheaper.
Yes,
Okay. Our cost is cheaper, not just what the doctors are.
correct.
Okay.
Yeah.
Any other questions or comments? Hearing none, I'll entertain a motion.
I will move to accept the changes to the fee schedule for for nursing, vaccines and other services.
Thank you.
Second.
We have a motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next section of the agenda is public comment. Do we have anybody signed up for public comment? Jenny? If we do, Attorney O'Brien, usually Marcel does the timing for me, 3 minutes. So if you don't mind.
I don't mind.
I'm
I
sure.
do that for the council too.
Okay, thanks.
There was no one signed up. However, I did receive an email earlier this afternoon. Would you like me to read that?
I forget what our policy is on emails that has to be read before the board.
You have discretion, doesn't have to be, but should be communicated to the board at some point. Whether you want it to be part of the meeting record or not is up to the chair or the president of the meeting.
Okay, I think I would prefer that if you just inform the board, it was a good email, and just let everybody see it and we can discuss it, at the next meeting. All right, next section, I thought you were gonna say something.
No, I'm sorry.
Time and place of our next regular meeting, November 20th. That's Wednesday at 4:30, right here. I will say, though, I will not be able to attend. So I wondered what the board's pleasure is. If you want to continue without me, that's certainly your prerogative, or if you'd like to move it. That's, and I know we were under some time crunch relative to the Health First Indiana funding and the grant process. Is there any advice you have relative to moving or not moving, or?
If Vice President Lindenman would not mind running the meeting and you guys are okay with meeting without our president, maybe we could just go ahead and have the meeting.
Do you have a sense of whether Dr. Lindeman will be able to attend?
And are comfortable? I don't.
Okay.
So we'll get back to you.
Okay.
What, how late can we go to move a meeting?
Right. So, and I'm sure Mr. Levin will coordinate this, but if you're gonna reschedule, it would essentially be a special meeting. So you've got to have 48-hour notice posting on the 4th floor here, and then someone, maybe you email all the media folks. So a lot of time for that.
Okay.
From a quorum standpoint, keep in mind, I think, so you've got 2 people not here and 2 vacancies, right?
Right.
So you've got to have, just like you have here, 5 people that can attend in order for it to be a proper meeting.
Okay. So I think what I'm hearing is let's leave it where it is, and we'll talk to Dr. Lindeman and make sure she can make it.
And also
I-
Mr. Harding as well.
Yeah, Mr. Harding as well, sure.
Is there something definite? I mean, we definitely would need to meet in November, correct? Or is
We're
there
working-
something?
We're looking at trying to get HFI grantees
Okay, approved in November?
so that we can get it through the proper channels during December.
Is there a date after which we'd need to meet by? Do you have a sense in order to
Well, like
keep
the f-
everything on track?
Ideally, it would be the 20th because the next Wednesday is the Wednesday before Thanksgiving,
Uh-huh.
because Thanksgiving runs and then you're into December. And so, yeah,
Possibly just move it to the 13th. Does anyone have a problem with that? Move it to the week before? Is that too early?
it may take us that long to get through all the HFIs, but all the RFPs, I mean.
So
might
you
be
need
kind-
the extra week.
Yeah,
Okay.
Okay.
All right.
Let's just sit tight and then,
well, I'll do my due diligence and make sure that,
yeah, I just realized this today when I was looking at next month's schedule. Sorry. Next section is our adjournment, so nobody objects. We are adjourned.
thank you.
Yeah, I know, I love it.